Hi there. Hey, I'm Jen Rice, and I was just reading an article by a pretty well-known dermatologist, Dr. Doris Day. She's been an instructor, author, practicing dermatologist for many years. I think she's also on Dr. Radio. If you listen to Sirius Radio, she does a piece on there for dermatology. But this article was all about environmental pollutants and basically how pollution affects our skin. And I was really fascinated by it, so I wanted to not only share this article but also some other interesting findings that really are linked to what's in our environment and how it's affecting our skin. I see you guys jumping on. Thanks for being here. I'm talking today about air pollution, kind of toxins in our environment, and what that does to our overall skin health. And believe it or not, the toxins in our environment, and it can be anything from smoke to pollution from plants, as far as like industrial areas. And what they saw was, what was really, really interesting is she cited a Korean study where they showed that the ambient air pollution, so basically just the particulate matter and pollution floating around in the air in Korea, actually worsened eczema for patients. And I find this fascinating because we do a lot of work in dermatology where we put a lot of creams on people, steroid creams, topical things to help get rid of the eczema. But it's important to know the root cause of where this is coming from, right? And so this kind of goes along with the functional medicine that I've been talking about in the past. And functional medicine is really getting to the root cause of illness. So I do think there's quite a bit of functional medicine that can intertwine into dermatology and really be used to be helpful for patients and, just for me and you. So, hey, Keely, thanks for being here. Yes, I know I'm going to get getting this information rolling again. I just came across this awesome article by Dr. Doris Day, who's a well-known dermatologist, and she was talking about, which is really cool to see, conventional practicing dermatologists start talking about things in the environment, things around us that increase our risk of skin cancer, skin dullness, skin roughness, aging. The environmental pollutants in the atmosphere definitely contribute to our aging, as well as skin sensitivity, like I just mentioned, the Korean study with eczema and discoloration, dryness. And so they know that they can do certain lab tests to like say they took something in the atmosphere, like maybe it was a burning rubber particle, let's say, and they can put it with skin and they can see what reacts. But there really isn't, there's a lack of research on air pollution in general as it goes with skin health. And so the more they're looking into this, the more they're seeing that if we can on our own increase our barrier function and our hydration of our skin, we can actually help with the overall health of our skin and be almost in defense, if you will, of all the things going on in the atmosphere. I mean, we're not going to, I'd like to say that we can do something to reduce pollutants and toxic elements in our environment, but it depends on where you live. And I know in her article, she said that especially more urban areas or more industrialized areas, they did see an increase in skin issues, even acne and other skin problems can be increased and almost flare based on the environment. And that doesn't mean you have to be living in a big city to have, the worst acne. It can be different exposures. Maybe it's pesticides, who knows exactly. There's a lot of things floating around. So one of the things that we can do, since we're not going to be testing our air ourselves every day and see if it's going to be a good skin day or a bad skin day, is we can begin to do some things on our own that really help our skin. And one of those things, of course, we always bring up, or I always talk about, is drinking more water. We know that we should be drinking about half our body weight in ounces of water a day. So you can kind of do the math there. I know I don't always do a great job of getting as many ounces in a day. I know one school of thought is to fill is to pre-fill the bottles with the amount of ounces you should drink in the day, and then you know how many bottles you need to get through, and it's sort of a visual marking. Those of you that maybe do that, you can tell me if that works for you. I tend to be the person that brings the one bottle with me to work, and I have every good intention of refilling it all day long, but it doesn't always happen. So hydration is going to be number one. Number two is UV protection. So, you know, using sunscreen, using something that is protecting the skin all day long. Three is antioxidants, and antioxidants can be, hey Crystal Bell, thanks for being here. Antioxidants can be oral or topical. And so when we're talking about taking supplements that are considered antioxidants, we're talking about vitamin A, vitamin C, vitamin D, the B complexes, and one in particular that she mentioned in the article was B3. So B3, she recommended 500 to 750 milligrams of B3 vitamins twice a day. And that would be specifically increasing the antioxidants to help the skin, right? And then, of course, you want to discuss with your physician any new supplements you take, maybe run these things by them. This was a published article by a practicing dermatologist. You can certainly take these numbers back to your primary care provider and go through that with them. This does not substitute as medical advice from your own practitioner, right? But I think it can be helpful to sort of see, are you even taking a B complex vitamin daily? Are you eating foods that are, another one she talked about was adaptogens. So foods that are rich in adaptogens. And when we think about those, we're talking about fruits and vegetables. So adding those in can be really powerful, just, you know, food as medicine wise, but you can also purchase supplements that are adaptogens. For example, CoQ10 would be considered that, resveratrol. What else was listed on there? I think curcumin, and there were a few others on there. So adaptogens are something you can supplement with, but you can also find these in your food. Making better food choices certainly helps. So I want to get to her 3 steps because I think this is really great. So 3 things that you can do every day: male, female, 18 years old, 88 years old. These are 3 things that we can do every day for our skin that can really make a big difference with this air pollution, environmental toxic elements that are kind of floating around. First thing is cleansing. So cleansing every day. You don't have to scrub, but you know, cleansing your face morning and night. That's the number one thing, because we're removing anything that is accumulated on the skin throughout the day. And one really cool thing she talked about was the free radicals or toxins in the environment acting like ping pongs on the skin surface. So actually poking, obviously we can't feel this, this doesn't sound really sciencey, but for what they're saying is that these free radicals are kind of making little holes in our collagen, and collagen is what gives us fullness, to our face, the plumpness, the look of youth. So the more we can keep from allowing those things in, the better too. So that brings us to step 2. So step 1 was cleanse. Step 2 is using a product that has SPF for protection. So you want to make sure you're protected really well throughout the day, all day long, not just a couple hours in the morning, right? So looking for a product that can give you that protection all day long. 3 is creating a barrier. So what do we mean creating a barrier? So if we know that the skin, it comes together kind of like this in a weave pattern. If our skin becomes intolerant, or maybe we're more prone to eczema, it's sort of like it's getting these little holes in it, and things are coming in and out. So the more we can create a protective barrier, the better our skin health will be. And the way that we do that is we use hydration. So we want to use products that are hydrating, and then adding antioxidants as well as part of that treatment and hydration. So I hope this video has been helpful to you today. If you found value in it, please consider sharing it. And if you'd like some suggestions from me of the products that I use, like I'm currently wearing something that's doing all the things that I need, helping me with environmental triggers, helping me with sun protection, creating a nice barrier, I'm happy to share that with you. You can reach out to me. And I hope you guys have a great day, and we'll see you soon.